Hello, and welcome to Week 9 of the Diabetes Education Program. You are listening to this recording because you missed your Zoom class on Week 9. So today we will do Week 9 and then you will follow up with your Zoom class for Week 10. My name is Connie Horton. I'm a certified diabetes care and education specialist and have been doing diabetes education for about 25 years. I also have had type 1 diabetes for about 47 years. So let's get started with Week 9's information. The things we're going to go over today is how diabetes changes over time, information about diabetes complications and delaying or preventing complications, the proper care schedule for adults and what you should have done when, taking care of your feet, getting enough sleep, planning pregnancy, an emergency care plan, emotional eating, and keeping physically active. Let's get started. Most people do have up and downs when managing diabetes. You probably completed information on page 95 and 99 in your workbook from last week. If you did, you can share your information with your educator when you meet with them next week on their Zoom. Let's talk about how diabetes changes over time. If you'll refer to page 100 in your book, notice in the graph how your own insulin levels change over time. Initially, when someone does not have diabetes, the pancreas works well and makes enough insulin. But then, prediabetes can occur. This is when your pancreas works even harder to make more insulin because your cells are beginning to resist insulin and not use the insulin like it should. This change occurs many years before diabetes actually starts. And then diabetes occurs. Your pancreas is making less insulin now. Your cells are becoming more resistant to the action of insulin also. And then from this point on, diabetes just progresses. Your pancreas keeps trying to make insulin, but your pancreas is wearing out and cannot keep up with your body's needs. You might need insulin at some point in your care plan because your body may not be able to keep up with your needs. It is common to need insulin at some point in your care plan. Needing insulin does not mean you did anything wrong in managing your diabetes or that your diabetes is worsening. As your diabetes changes over time, so does your care plan. The goal of your care plan, of course, is to keep your glucose in target range. Let's talk about complications in diabetes. If you'll turn to page 102 in your book, this is where it talks about diabetes and complications. A complication is a problem that arises following or as a result of an illness, disease, treatment, or procedure. Complications typically occur due to high glucose levels over time, not just an occasional high result. Complications can occur in various organ systems. This slide shows the different organ systems that can be involved with complications of diabetes. We're going to go over some of these different complications in the areas of the body. For our brain, memory and learning problems can occur from high levels or very low levels of blood glucose. Damage to blood vessels can also lead to stroke. High glucose can damage blood vessels in the eye that leads to vision problems. And high glucose levels lead to more bacteria and gum disease. Of course, we've talked about heart disease and diabetes because high blood glucose damages large blood vessels leading to plaque formation and heart attacks. And high glucose damages small blood vessels in our kidneys, making the removal of waste more difficult. Also, high glucose can damage large and small blood vessels in your legs and feet. This can lead to sores and cuts that don't heal well, which can lead to infections and poor healing. Also, this can lead to amputation. And then, of course, high blood sugars can cause nerve damage that interfere with sexual functioning. But there is some good news. On page 104 in your book talks about how, when you're keeping your blood sugar in good control, you can reduce these complications from occurring. Just by dropping an A1C value by 1% is equal to a 25 to 30% drop in kidney, eye, and nerve damage. This was proven in the Diabetes Control and Complications trial, which was about a 10-year study that even ended sooner because they prove that the better control someone has with their diabetes, the less likely complications are going to occur. We also should have a diabetes care schedule, and ongoing appointments with your care team are important in maintaining good health. On page 105 and 106 in your book, it is recommended typically that patients should be seen at least every 3 to 6 months. It also shows what types of tests should be done at those visits. On our next slide, the images that are on it may be a little upsetting to some because we're going to talk about taking care of your feet, and it's going to have some pictures of some sores and stuff on the feet, so just be aware. Taking care of your feet is very important. You should have your feet examined during an appointment with your health care provider. Do you check your own feet each day? High glucose levels can lead to nerve damage. Foot problems such as cuts, sores, ingrown toenails left untreated, or unnoticed can result in infection. Poor circulation due to high glucose makes the problem even worse. As you see on the pictures in the slide, that there are foot ulcers, there are blisters that have broken, looks like a corn on the end of that one toe, and these kind of areas are difficult to heal if blood glucose levels are high. Because if blood glucose levels are high, there's more glucose that can get into those sore areas and cause the bacteria to grow more rapidly, because the bacteria will thrive on the sugar that's in the bloodstream. But also you must remember it's difficult to heal if you have poor circulation in those areas. So it's important to take care of your feet. You can do this by cleaning your feet. You should wash your feet, not soak them, but just wash and dry well. Trim the nails straight across. Check your feet every day. Use a mirror looking for cuts or sores. Shake out shoes for objects that can injure the feet. If it is difficult for you to see your feet and you live together with a family member, maybe they should check your feet for you because it would be easier for you, especially now that they know what to look for. You should also take your shoes off at your health care appointment with your provider so that they can be prompted to look at your feet. You should also protect your feet by not using hot pads or cold directly on the feet, and make sure you wear well-fitting shoes. Should also treat any sores or cuts or dry skin with creams or lotion on dry feet. Avoid between the toes. You should treat corns and ingrown toenails at your healthcare provider. You should not use any sharp instruments on your feet, and you should keep cuts and sores clean. And if things don't heal in a week, you should seek medical care. Let's talk about sleep. On page 108 in your book talks about sleep, and you also have a handout on sleep. I'll let you pull the handout out. It says, "Do you get enough sleep?" at the top, and has an eye mask at the top. 1 in 3 adults don't get enough sleep. We really need about 7 or more hours of sleep a night. Lack of sleep is linked to several chronic diseases and conditions including type 2 diabetes, heart disease, obesity, and depression. Just some general tips for good sleep would be to go to bed at the same time and get up at the same time. Avoid beverages with caffeine in the afternoon and evening. Also, not eating a large meal in the late afternoon or evening. Physical activity can also help you fall asleep better at night. Get into a comfortable routine before bed, like keeping the bedroom quiet and dark and at a comfortable temperature. Stop watching TV and using electronic devices at least 30 minutes before bed, or just remove all these devices from the bedroom. And if you share a bed with someone, get on the same routine with stopping the device use and when going to sleep. Let's talk about pregnancy a little. You may not be planning to get pregnant, and you may even be a male and not getting pregnant at all. But you never know. You might run into someone who has diabetes that wants to get pregnant, and you can share a little information with them. So we're just going to do this little slide about 12-month pregnancy plan. Of course, if you're planning to become pregnant, you will need to work with your healthcare team before conception to have a healthy pregnancy. You should keep your A1C less than 7% for 3 months before the pregnancy and the 9 months during your pregnancy. Your glucose goals and meal planning will change during pregnancy, and your medication needs will change as well. Now let's talk about the emergency care plan. You also have a handout for this in your packet. I'll give you a few minutes to get it out. It says My Diabetes Emergency Plan at the top of the page, and it has caution tape at the top and bottom of the page. No one wants to think about an emergency, but we all must plan. Do you have a plan, and do you have what you need? There are different types of emergencies, such as weather, which might include tornado, earthquakes, also things like pandemics. There are things that you might need. On the handout, list things that you need and have a checklist for stuff that should be in your emergency care plan. I always recommend to have a good supply of medicines and don't wait until the last minute to get your medication filled. I like to think of this like pulling into the driveway with an empty tank of gas. You're not going to be able to go anywhere if you have an empty tank of gas. But if you drive into your driveway and your tank is full, you'll be able to go anywhere. If you have your diabetes care kit ready for emergencies, you should be able to survive your emergency. Things needed, I'll kind of go through the handout. You should have a portable, insulated, and waterproof diabetes emergency kit that contains the following items. Basically, a piece of paper with a list of the items such as what type of diabetes you have, all your medical conditions, all medications, and contact information for your healthcare team and 2 emergency contacts. It is nice to have a letter from your diabetes professional that has the most recent information about your healthcare plan. Also, having your insurance card, living well, healthcare power of attorney, and things like that. Also, your most recent laboratory results, such as your A1C, kidney, and liver tests, would be nice to have. Once again, a 30-day supply of all your medicine, blood glucose testing supplies, if you're on continuous glucose monitoring, supplies for that. And I would always recommend having a backup glucose meter with extra batteries, and possibly even 2 of those. And a cooler that has room for refreezable gel packs to keep insulin and any medication that needs to be refrigerated. You should have something for your sharps, some type of sharps container, carbohydrate source for low blood sugar, 2 days supply of non-perishable food, at least a 3-day supply of bottled water, of course pen and paper, and first aid supplies. I always recommend wearing shoes, especially if you're preparing for an emergency. So if you're in a tornado shelter or some type of shelter, keeping your shoes and socks on while awake, and examine your feet often for cuts and sores and spots. But having those shoes on, make sure that you can protect your feet if the emergency does occur. Make sure your vaccines are updated, pack comfortable clothes, make sure to take your mobile phone and extra charger and batteries, and choose a designated meeting place in case you're separated from your family. Now, let's talk about emotional eating. On page 110 in your book has information on emotional eating. When we emotional eat, that means we tend to overeat sweets and salty foods when we have emotional issues. Also, sometimes you may eat portion sizes larger than usual in response to emotional triggers instead of hunger clues. Emotional eating can create problems in the long run. You tend to have trouble knowing when you're truly hungry. You cannot solve problems that are bothering you. You just try to eat them away. It can affect your diabetes management, of course, from overeating. It can be a difficult behavior to change. Some emotions that might trigger overeating for you are being stressed out, being sad, possibly being happy, lonely, angry. All these things are triggers. You should know your triggers. Identify strategies for dealing with your emotional triggers. And practice being aware of your hunger, using that hunger scale that we talked about in week 5. Think progress, slowly but surely. If you're not feeling hungry and you're feeling emotional, like you're going to emotionally eat, what do you truly need during this time? Maybe it's friendship. Maybe it's relaxation. Maybe it's sleep or physical connection or touch. Maybe it's someone just to talk to who will listen to you. Or maybe you need some physical activity. If we can stop emotional eating, this is a good thing. But stopping emotional eating can seem very overwhelming. So I recommend seeking help if you have issues with this. Let's talk about physical activity and being physically active. We've discussed this a lot during different sessions. If you need reviews on this, I would refer back to your Type 2 Diabetes Management book and think about what are the benefits of being physically active. How do you keep yourself motivated? And what are your favorite activities? I'd like to review about motivation just a little bit because I think that's the hardest part for most people. Ways to stay motivated might be by making an appointment to do your physical activity. So putting it on your calendar. Maybe building it into your breaks like at work. Maybe going walking with a pet. Have a partner that you exercise with. Plan for bad weather days when you can't be outside. Make yourself accountable. Check how does activity affect your blood glucose. If you see your blood sugar is lowered by activity, it might motivate you to do it more. There are many things out there these days that help us to do activities such as MyFitnessPal for tracking. You might have a Fitbit that you wear. There's also an app called Fit On. It is a free app and does have classes that you can put on your TV and do, such as yoga, bar, boxing, endurance, and they're all at different times and different lengths, so something might work for you. We also gave you the handout on exercise early on when we first talked about exercise, so review it, and it might help you get started too. That's the end of week 9 information. For your final session, I'd like for you to bring your Diabetes Basic book and your goal setting workbook. Thank you and have a great day.